Hi, I'm Dr. Katie Landier, the Senior Centered Physical Therapist, and welcome back to my channel. In today's video, I will be demonstrating some tests as well as treatment techniques for BPPV. I just want to say this first. This video is just intended for information purposes so clients can know what to expect if they're being tested or treated for BPPV. Unless your provider, your physical therapist, or your doctor specifically tells you to do these exercises on your own, please only do them under the supervision of your therapist and doctor. Today we're going to look at the Dix-Hallpike as well as the head shake test, and then treatment approaches include the Epley Maneuver, the barbecue roll, and the Semont. So let's get started. This is Katie Fisher, our Senior Centered Occupational Therapist, and she is going to help us with our demonstration for our BPPV treatments and tests today. So we're going to start with tests first. Please once again note that these are not meant to be done by yourself at home. These are meant to be done with your provider. This is just so you know what to expect. So the kind of traditional tests that you will see done if you're experiencing or someone thinks you're experiencing BPPV is the Dix-Hallpike. So with this, Katie does not have any kind of vertigo, but we're going to pretend that she's having vertigo when she turns her head to the right. So for the Dix-Hallpike, what I'm going to do is I'm going to take her head and I'm going to turn it 45 degrees towards her affected ear. And what I'm going to tell her is, I'm going to lay you down on the table, your head is going to be off the table, and I'm going to support it. But what I really want you to do is make sure you keep your eyes open. You'll likely experience dizziness if you have BPPV, but it's really important to keep those eyes open so your therapist can see your nystagmus or that bouncing of your eyes. So the other thing I want you to tell me is if you get sick. If you feel like you're going to throw up, I have a trash can here, make sure you let me know. So once again, that is normal to feel that way. Just let your therapist know. I promise they will appreciate it. So you're going to turn their head, and then we're just going to lay you down and keep those eyes open, and I'm just going to look for any kind of nystagmus. What tends to happen with nystagmus is there's a latency period. So I'm going to wait for about 30 seconds until I start to see nystagmus. If I don't see any, I'm going to sit her back up. So we're going to pretend that we see some nystagmus. So I'm going to hold it here for 30 seconds or until the nystagmus subsides. And then when it subsides, I'm just going to bring Katie back up. So that's the Dix-Hallpike test. Another test that might be done is the head shake test. So for this, I'm just going to have Katie lay all the way down. And what we're going to do is I'm going to tell Katie to just close her eyes, and then I'm going to shake her head side to side. And then I'm going to stop and say, open your eyes. And once again, I'm checking for nystagmus. So checking for that beating of the eyes, and then asking, are you dizzy? No. No? Okay. So I don't see any nystagmus in Katie's eyes, which is good. We didn't give her vertigo during these. Now we're going to move on from our tests to our treatments. Okay, we are going to do an Epley Maneuver, which is very similar to a Dix-Hallpike. So what we're going to do is I'm going to turn Katie's head once again towards that right side, her affected side, and then I'm going to lay her back down, and I'm going to watch for that nystagmus. I'm going to hold this position for 30 seconds. And then after 30 seconds, let's say our nystagmus has subsided, I'm going to turn Katie's head and I'm going to ask her to turn to the left. So she's going to roll onto her left side, and she can take her time. And then I'm going to turn her head down towards the floor, and we're going to hold that position for 30 seconds. And I'm going to ask her if she's dizzy, and once her dizziness has subsided, her nystagmus has likely subsided as well, and I can usually see kind of in the whites of her eyes. Then I'm going to help her sit up. So I'm going to have her bring her legs off the front of the table, and then she's going to push down into her hands. We're going to sit up, and she's going to keep her head upright. So you will go home with instructions from your physical therapist on head movements. You likely won't be able to lay flat to sleep, so you might have to sleep in a recliner for 24 to 48 hours or something to that effect. So make sure you check with your therapist as to what their instructions are for you. Also know that the Epley Maneuver, the Semont, which we'll see, as well as the barbecue roll, have all been shown to be very effective for treating BPPV, but they might take multiple attempts and likely will take multiple sessions. So it's not a quick fix necessarily, but usually in about 3 sessions, patients find that there's lots of success with these treatments and they're not feeling that dizziness anymore, which is fantastic. The next thing we're going to do is the Semont. The Semont, like the Dix-Hallpike, helps with that posterior canal BPPV, that canalithiasis. It's also been tested for cupulolithiasis, but they're finding different research on what is more beneficial for cupulolithiasis, so using vibrational tools and things like that, which we won't demonstrate in this video. So we will demonstrate the Semont maneuver and how it's done for canalithiasis. So with the Semont maneuver, which has also been shown to be effective for that posterior canal BPPV canalithiasis, we're gonna turn Katie's head, so this is her right side, we're gonna turn her head away from her affected side, and we're gonna have her lay down on her side. So we're gonna go quick with this one. So we're gonna lay you down on your side and you're gonna bring your feet up so you're laying on your right side. Ready? 1, 2, 3, come down. I'm gonna hold that head there. Good, are your feet comfortable? Okay, good. I'm gonna hold this for 30 seconds and then we're gonna flip Katie to the other side and her head is gonna face down towards the floor. So your feet are gonna drop down. We're gonna flip her over and she's gonna look towards the floor and we're gonna hold that once again for that 30 seconds, waiting for that nystagmus to subside. Then I'm gonna help her sit back up. And once again, she's gonna go home with instructions as to how to sleep, how to hold her head, things like that. Also, when you're getting these tests done, if you know you're getting these tests done, I recommend bringing someone with you to the clinic so that they can drive you home, as these will likely make you feel dizzy. The last one we're gonna go over is the barbecue roll, which is a treatment that can be done for horizontal canal, BPPV, and can be done on your own. So I'm gonna bring Katie a pillow and then I'm gonna walk her through how to do the barbecue roll. So Katie, I'm gonna have you sit with your feet on the table. And then you're gonna walk yourself down to your back. So kind of go elbow and then shoulder, yep. And then so your head is gonna be on that pillow and then you can take your time to adjust. So bring your shoulders down so it's just your head on that pillow. Excellent, good. So you're then gonna roll onto your affected side. So we're gonna say you're gonna roll onto your right side. Yep, keeping your head in contact with the pillow the whole time. So we're gonna hold that for 30 seconds. And then Katie's gonna roll onto her back after that 30 seconds is over. So she can roll, taking her time, keeping her head in contact with the pillow. Then she's gonna hold this position for 30 seconds. Once that 30 seconds is up, she's gonna roll to her left, so her non-affected side. And she's gonna hold that for 30 seconds. And then this is the difficult one for most people. So what we're gonna do is Katie's gonna end up on her hands and knees with her forehead touching the pillow. So I like to have my clients do a little chin tuck. So she's gonna put her head towards her chest. She's gonna roll her forehead onto the pillow as she comes to her hands and knees. So elbows, think forearms and knees. So come all the way to your knees. Yep. Yep, and then whatever position she can breathe in that her neck is comfortable, so she can shift back on her hips a little bit if she needs to, just keeping that forehead down. Forehead down, good. And can you breathe?
Yes.
Okay, good. She's good, she's breathing. And once again, she's gonna hold that position for 30 seconds. Once that 30 seconds is over, she's gonna roll back to her affected side. So she's gonna come to her right side. Good, trying to keep that head in line with the pillow and scoot forward a little bit so you've got some table behind you. So once again, 30 seconds there. I'm gonna adjust her head just a little bit so it's in line with her spine. There we go. And then she's gonna carefully sit up. So she'll bring her legs off the edge of the mat and then sit herself up. Very good, you feeling okay? So the barbecue roll is usually done multiple times, but she'll wait at least 5 minutes before she does it again. Once again, a lot of these moves need to be done multiple times before they're actually effective. That's perfectly normal. Just make sure you're checking with your physical therapist to see what your instructions specifically for your BPPV are. Thanks so much for joining us. We hope this was really informative and helped you learn more about BPPV. Thank you so much for watching this video. I hope it was very informative and educational for you. Please remember to check out my blog, theseniorcenteredpt.com, to find out more about BPPV, as well as give this video a thumbs up and hit that subscribe button so you can help other people find my channel, as well as get notifications for all future content. Thanks so much for watching. As always, I'm Dr. Katie Landier, the Senior Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.